probably a fairly small club that can say they've done 20,000 cases, and I think the significance of it is it's an accomplishment and worth commemorating, I think, by itself, but it really points out that we have an experienced, mature program.
I was the first cardiologist in this area. I came in 1974, and we just celebrated our 43rd anniversary of the Valley Heart Associates. We've been here 43 years, and we have a great team of doctors. And I got to choose most of them. And the way we choose doctors is we want to get the very best doctor we can possibly can. Excellence is very important.
I have a long history. I've been here 39 years, so longer than anyone who's currently here. It just happened that I wound up with a 20,000th case, and 20,001, 2, 3, 4, and 5, I think. But
so we're celebrating 20,000 heart surgeries, which is a huge number of heart surgeries. Just think how long it would take you to count to 1,000, much less 20,000.
I have no regrets. It's been a life well spent, and we've helped a lot of people. So
my doctor was wonderful and everybody was nice, but I knew I was fixed. So I'm in the hospital, but I'm thinking I'm on the downside now. So no, it wasn't bad. I was thinking, yeah, I made it. I'm good. I'm good to go here. So I asked a lot of questions. How far can I come back? How quick? What can I get away with? What can I be able to do again? Boom, boom, boom. And he just said, well, that's kind of up to you. I fixed you. You're fixed good. So that's up to you now. So
the changes I've seen for women's health is really in the cardiac area, because we know most of the research that they've done in the past have been on men. And so education as far as symptoms for heart disease has been really a focus lately. And that's actually what led me to realize that I may have had a heart issue, because the only thing that I had was shortness of breath.
So there was a difference in opinion of how these patients should be treated. Some people said, well, medicine's good enough. Other people said, heart surgery's the final answer, because you're actually putting new arteries in the heart. We presented the case to both the medical doctors and the heart surgeons. And we said, the question was, what's best for this patient? And we're going to do what's best for the patient, because we're all in one group, all cooperating, team effort. Go team.
Well, I'm proud to be one of the 20,000 because that means I'm still here. And so I feel very good about that. And since I was on the back end of the 20,000, it also gave me reassurance that they had done this so many times that they knew what they were doing.
The oldest one I remember we operated on was a 96-year-old. We operated on him, and he was a dentist. And then we operated on a 93-year-old, and he was a farmer. The farmer went back to farming, actually. And the dentist, I don't think he was doing dental work anymore.
We've had our own charitable organization here called the Medical Relief Foundation, and we've gone to Guatemala, Nicaragua, Guam, and Russia. Done heart surgery there. Particularly in Guatemala and Russia, we brought heart surgery to areas that didn't have it before.
Personally, as a doctor, the one thing I do want to mention is this. The hospital's been great, and all the nurses are great. And it's not only me, it's all the doctors who worked on us, the anesthesiologists, the kidney doctors, the stomach doctors. All the doctors work together, and I really like that. And the second thing, which I'm really proud of, is this, is when we started out, they said to me, I learned that a lot of patients didn't have any medical insurance, and they were very poor. So I said, come bring them in. We're here to treat heart disease, not to make money. We're here to help people out.
I still see Dr. Lou, and every time I see Dr. Lou, he smiles at me, I smile at him, and I just will never forget him. Because every day that I was here, he came to visit me, he sat on my bed, he took his time, he talked to me about everything that was going on, and then I was with him with my follow-up visits. So when we see each other, it's like, I know what you did for me, and I think he's happy that he did that and that he can see me walking around.
I'm grateful for Doctors Medical Center. for how they took care of me and how the procedure they gave to me and let me regain my life.
And that's what I think about, how special that was. I had actually 5 blocked arteries, and they took the veins from my leg and then, put them in my heart. And that just seems so simple, but it's so special. So to be that kind of surgeon, to be able to do that, to continue on with the life, is just so special. And so I'm very appreciative.
I am 1 in 20,000.
I am so proud to have worked on so many of the 20,000.
I am proud to be 1 in 20,000.
I'm proud to have worked on so many of the 20,000.